Okay, hi everybody. I do not know who was in our last presentation. My name is Dorothy Machira. I am a nurse by profession, and my main area of practice right now is education. I'm a staff developer where I work, which basically means that I'm tasked with the responsibility of educating all staff. So I educate nurses, I educate caregivers, educate every employee in the facility that I work for. And we are about 210 employees. So I'm very passionate about education. I would love for this to be an interactive process. And first off, I would love to give kudos to Timothy, who I've been working very closely with. Team, great job. Thank you for your guidance and your patience. And I'm really honored to be a part of this education process for you guys. So can you guys see my screen?
Yes.
Okay. So I know that we did do trauma-informed care a few weeks ago, but it looks like Anna wanted me to do a refresher. And obviously, like I said, I would like this to be an interactive process. So I would like to know from anybody if you're comfortable sharing what you took away from the last trauma-informed care that we did. Anybody?
What'd she say?
Can you guys hear me?
She asked what did you say?
Oh, so I asked, is anybody willing to share or say something about the last training, what you took away from the last training if you were there?
I wasn't there, so I don't know.
Okay, that's okay. So with our last training with trauma, I think the one thing that I wanted us to take away from it the most is that most of us have been through a traumatic event in our lives. We did see that there was a lot of people that have had more than one traumatic event, right? And the summary of it for me was when we witness somebody behaving a particular way, our question should not go to what is wrong with this person. The question should be what happened to this person. And so this time around, I did kind of narrow the trauma-informed care training to individuals that have developmental disability, which is the population that I'm sure you guys are dealing with on a daily basis. So trauma-informed care in itself is a training that is going to help you approach and recognize the widespread of the impact of trauma. Now, sad as it may seem, patients or people that have developmental disabilities are 2.5 times more, 2.5 times more likely to be victims of violent crime compared to other populations. 31% of children with developmental disabilities have suffered abuse, child abuse. And obviously we know that children grow. We're all a product of being a child once. And 31% of children that have disabilities suffer some form of abuse, and that is compared to 9% of children that are not disabled. Now, what I found in a blind study that was done a while back, 14% of direct caregivers admitted to committing acts of violence against adults that have developmental disabilities. And 35% with 35% witnessing such violence. Now, for me, that kind of stopped me right in my tracks, right? And we will be talking about why that might be, because I think it's pretty courageous for people to actually admit that, hey, yeah, at one point I was super upset and I responded. in a particular way to a patient that had that was maybe acting out of character. And also recognizing trauma in individuals with developmental disabilities can be difficult if they are having limitations in cognition and or have impaired communication capabilities, which may then interfere with their ability to have you know what it is that they need from you at any one particular time. So recognizing whether an individual with developmental disabilities has experienced trauma, especially if they have limited cognition and communication capabilities, can be very difficult for you as a caregiver. But it is also, though, in line of your work and in line of you being able to serve the clients that you're dealing with, to kind of also be curious what this particular patient or this particular client might have. So examples of some diagnoses that you guys might be dealing with as far as your clients go, you might be having patients that probably have a diagnosis of Down syndrome. Some might have a fecal alcohol syndrome. Others might have fragile X syndrome, and others might have autism, right? But then every diagnosis affects every patient differently, and every patient is impaired differently, which means that we might have some people that are higher functioning. You might have a higher functioning autistic child or autistic adult. You might have somebody that has a fetal alcohol syndrome, but is also very high functioning. They might be able to get a job, might be able to be active in our communities, right? But if they have then suffered a form of trauma, given that they are impaired or they have a disability, the way they manifest their behaviors or the way they communicate is definitely going to be very difficult. So the signs and symptoms that can appear in our patients or our clients might be them having difficulty acquiring a new skill. They might have difficulty in processing new information. And they might also have poor and verbal communication or loss of it at all. We do know that we have patients or clients that are not able to communicate at all. Psychological effects, they might complain of stomach aches, headaches. They might have difficulty sleeping. They might lose loss of acquired developmental skills, bedwetting, and soiling. And behavioral effects might be aggressive behavior. They might scream at you. They might yell. They might be irritable. They might be verbally abusive to you and being fearful or avoiding of people or situations. So now for you as a caregiver, it is so, so important to be able to recognize these signs and symptoms. Because if a client becomes physically abusive or reacts in aggression, then where does that place you as a caregiver? Now, I want to believe that when instances of caregivers abusing patients occur, it's mostly maybe a caregiver responding in kind to the way the patient or the client is behaving. But if you do witness a behavior change in a client that you had not previously seen, what do you guys do? If, for example, you notice that a patient who was not cutting themselves or was not hurting themselves, if they start to do that, what do you guys do? Anybody willing to share? Anybody?
I can speak for my client. I noticed when it, like last trauma care that we've had, that it was noticing the behavior changes starts with, for my client, I notice if, you know, she's getting a little agitated or a little upset, I take a step back and I say, well, can you tell me what's wrong? And it's something deeper of why she's behaving like that. Usually it's something, it could be something very small but very big to her. Just
Yes.
take a step back and give her options and choices of like, well, what do you need? How can I help you? things like that. And then we get down to what's really bothering her, and she's able to tell me, and we're able to fix it before it gets too out of hand.
Perfect. Thank you so much, Jerica.
You're
And
welcome.
again, it goes back to, I like to say that we as caregivers, we as care providers are in this line of work because we have chosen to do it. And for me, I think the most challenging part of it is, because I've been a nurse for over 24 years, is one, seeing people that have gotten into this line of work for the money. There is money to be made and there are hours. There's a lot of overtime. And then you also meet people in this line of work that are here because it's a calling, it's a vocation for them. They're very passionate about it. So for you guys, especially when you're providing care in a home-like setting where you're going into a client's home, one, you probably are not very versant with what has happened to that patient. So what is going to happen is when you see a patient behaving a particular way, they're either one, trying to say something, two, they might have an infection. And I know we'll be having another training later on this afternoon, and we'll be kind of talking about that. Three, they might also be tapping into a trauma. If somebody is used to being hit, is used to being punished, is used to being maybe tied down because they're being aggressive, they're being erratic, and they're restrained. When you as a caregiver step into that scenario, that particular person is expecting you to do to him what has always been done to them, right? So in the next slide, we see that often some symptoms of trauma or abuse in a person with disabilities are interpreted as behavior challenges for you guys, because they might have outbursts, they might be pacing, they might be yelling, they might be causing themselves harm. And they can also trigger, as they're doing that, and your response to them might trigger a traumatic experience. It is so critical then that the staff, which is you, know how to de-escalate a situation. If a patient that has a traumatic episode starts to yell, and you in turn start to yell, you're more likely to aggravate them even more. Now, what I have witnessed personally in my line of work is, for example, when we're dealing with patients that have some cognitive deficits, somebody might be wanting to go to the bathroom, but they're not able to communicate that, right? So they'll start hitting their head. They'll start pacing because their body is saying something, but then the brain is not communicating that as I would, because if I need to go to the restroom, I know I have the urge, I'm going to go to the restroom. But now when you're now dealing with somebody who is not able to communicate, has been traumatized, maybe by when they have soiled themselves, the caregiver has been rough with them, or the family has been rough with them, or they have had to sit soiled for hours and hours on end, and they've had skin issues related to not being changed on time. The way they react to that might be very, very different. So for me, and I think it is so, so important that when we see a behavior with a patient, again, let's tap into what we have learned as far as trauma-informed care is. It is recognizing that any form of trauma that your client might have endured in their lifetime, obviously they carry it forth. They don't leave it or lay down somewhere, but the truth of it is that caregivers also receive a lot of abuse from these patients. But for us, and what I tell my staff is, when you are taking care of a patient, you are the authority. The patient is the one that needs your service. You have to remove yourself from a reaction, from reacting. If a patient lunges at you, right? You should know, for example, if a patient has a deficit and they're used to hitting, and that has been your client for a while, you do know, one, what might aggravate it. Two, you might want to know what side or where to stand when you're speaking to these patients. And three, you also must figure out some triggers. Is there something that happens that triggers them? If it's a loud noise, maybe a patient is having trauma from being yelled at. Because like for me, I don't know if I said it last time, if somebody yells at me, I completely go into a cocoon. Anything that you say after that, because I was yelled at I was yelled at as a kid. So it is super, super important for us to know that challenging behaviors or outbursts are not a reflection of what we're doing wrong. It might be a behavior from a trauma that a patient has endured in the past. Do we have any questions this far? Any questions? Okay. So principles of trauma-informed care. This is something that we talked about pretty much in detail the last time that we met. And the 4 principles are safety, peer support, trustworthiness, and transparency, and collaboration and empowerment. Now, safety. You as a caregiver have to ensure physical and emotional safety for your patients. Now, if your client came from a traumatic background, and now that you are a caregiver, you are tasked with the responsibility of making sure that that patient is safe. And I'm going to use the word, client advocate. If you don't feel that your client is getting enough resources, if you go into a home and you realize that your patient is being abused in your absence, you have the moral responsibility to say something. So for us as caregivers, we come and go, but the patients that we're taking care of don't get to take a break from the challenges that they are facing or the traumas that they have endured in their lifetime. So it is super, super important that we adopt the principle of making sure that we are creating a safe environment for our patients. Then 2, peer support. If your clients have access to adult programs that offer activities, we need to make sure that they're, 1, being able to access it. 2, we are working hand in hand with the office to make sure that they are getting there, because these peer support groups are so, so important. Now, again, when I think of myself and the fact, or yourself, you can wake up at any particular point and decide you're going to do A, B, C, D without any limitation. Now, depending on the severity of the clients that we are dealing with, they are limited in that. So they are not able to do whatever they want, whenever they want, get in a car and go wherever they want, right? So we need to recognize that the peer support that they get from adult programs or any other activities that they have going is a lifeline for them. Then trustworthiness and transparency. We have to build trust through clear communication and transparency in decision making. If you are going to decide to do something for a patient or a client, sorry, I keep interchanging the words patient and clients. You guys deal with clients, right? I'm used to dealing with patients. We need to make sure that they are a part of that decision making, and 2, that we are trustable. If you say you're going to do something, let us make sure that we're doing it. If we say we're going to do it at a particular time, let us make sure that we are doing it. Then actively involving individuals in their care planning and decision making. If a patient is not able to, for example, dress themselves, it's okay for you to ask them, hey, what do you want to wear? Because what I've noticed with some of the caregivers that I supervise, somebody will come in, go to a patient room, pull out some clothes, put them on the bed. And sometimes you will see the patient wanting to be like, no, this is not what I want to wear. But most of us are so task oriented, right? You want to get in, you want to do A, B, C, D, you want to get done, because for us, it's a job. However, we need to know that the worst thing that you can do to anybody is take away their autonomy and their ability to choose, or ability to do something, or ability to have a choice. So it's very, very important for us to make sure that even the patients that we're taking care of are able to maintain a level of autonomy. Now, the importance of trauma-informed care, especially for the patients we're taking care of, is basically to realize that when we're taking care of a patient, we should not just look at this patient as a singular person. We need to be able to look at this patient wholesomely, which is what we call a holistic approach. We need to be able to take care, to be able to acknowledge that there might be some mental health issues involved. We need to know that there might we might encounter behavior challenges. And we have to also know, as we said in the beginning, that these people are 2.5 times more likely to have endured massive trauma during their upbringing, right? So in doing that, we're looking at a patient not just as somebody that is hard to get along with. We're not looking at this patient as somebody crazy. We're concentrating on how they behave. Now, I know that about 2 years ago, there was a police incident where they responded to a cry from a caregiver who had a patient that was having behavior issues. And unfortunately, it ended up with the death of the patient because of the client, because when the police came, they did not know how to deal with the person. They thought the person was being highly aggressive, and this person was shot down. So if we are going to call the police in an instance where a patient is manifesting behavior issues, it is critical when we're calling that 911 number to let the person on the other side know that you are dealing with somebody that has developmental disabilities. I cannot emphasize that enough. Because again, the trauma-informed care training, it's now just getting momentum. This is not something that we were taught, even when we're going to nursing school. But now as we're beginning to see younger and younger people, or obviously with more people being able to go home and live independently, it is something that we're having to stop and look at. Then the other importance of this training is a reduction of adverse outcomes. Like I just said, if we're communicating issues, if we're taking a patient to the doctors and they have behavior issues, it's important to let the person that you're, if any behavior issues start coming up, it is very important for you to let this person know that, hey, A, B, C, D. So because a lot of people, so for example, when somebody goes to the ER and they're very aggravated, you don't really have time as a nurse to assess, why are they aggravated? All you see is the aggravation, and then your job becomes to either medicate them to stop the aggression. But for you as a caregiver, if you're accompanying them to this appointment, it is very, very important to say something to the caregivers. And empowerment and recovery, by involving individuals in their care and decision-making, trauma-informed care supports self-advocacy and empowerment. Now, let's remember that though these people that we're taking care of, the clients, are clients or might be deemed as patients that are not able to take care of themselves wholly, right? They still have the ability to make some form of decision, right? It might not be the best decision, it might not be the most comprehensive decision, but it is important for us to know that they do need to have the ability to make some decisions that affect them. They should be able to say something to somebody if the care that they're getting is not sufficient or okay for them. Now, strategies for implementing trauma-informed care. Again, training, as we are doing today. We cannot be over trained in how to deal with anything, because obviously for me, I'm doing my doctorate, right? And it's almost like when I think I've written the best paper ever, when I go back and look at it, I will find things that I did not know. Like in even researching and doing this training, I have found so much material in dealing with developmentally challenged individuals. Now, what I tell people is be proactive. There's so many resources out there on anything that you really want to know. Look up videos on trauma-informed care, look up videos on de-escalation methods, look up videos on how to react to a situation, right? There is so much information out there. Then create a safe environment. We already said that. When your clients see you, you should be their safe zone, for the amount of time that you are there. We should also be able to assess our clients' environments to ensure that they are safe. If you deem that they are not safe, then you need to be telling somebody about it. This includes predictable routines and reducing sensory overload. Now, again, if we're talking about a developmentally challenged individual, some autistic people cannot take noise, right? So if you are in a room with them, I don't know if you guys are watching television. Sorry? Somebody wants to say something? Okay.
I just muted them. I think they were just moving around.
Okay.
Yeah, we're good.
Okay. So we need to be sensitive to that. Let us not do things. Again, it goes back to trigger. If it triggers them, let us make sure that we are staying away from it. Effective communication. Now, for me, communication is so big. Because I don't know if you've ever been in a situation where you're trying to say something to somebody and they just don't get it. They just do not get it. And it becomes very frustrating for you because what you're saying is not being received in like. So we need to be able to adapt to the communication styles of the people that we're taking care of, because not everybody is going to communicate the same. I give an example of your client might exhibit a particular behavior when they need to use a restroom. Your client might exhibit a particular behavior when they're hungry, when they are in pain. So adapting communication styles to meet the needs of your client is so important. And again, if they're able to understand, go ahead and repeat, ask them a question. Hey, if they're saying, if they look like they're so uneasy, they need to go to the bathroom, you can ask, hey, is it that you want to go to the bathroom? Do you want me to help you go to the bathroom? Or if they're able to talk and you didn't understand, go ahead and repeat what it is that they said to you, just to clarify that what they said to you is actually what they want you to do for them. And then, of course, individualized support plans. We don't have a cookie cutter formula for dealing with all our patients. Every patient is unique in their own way. They present a particular behavior in their own way. So it is critical that you are not looking at yourself as just somebody that provides a service. Look at yourself as somebody that is helping, and be curious. Study your patients, right? If you see more than one patient, just know that what works for A is not necessarily going to work for B. We cannot categorize all developmentally challenged individuals as the same, right? Because as we said, they all have different diagnoses. They all have different traumas. So when we are dealing with them, let us not look at them and brush them with one brush stroke and assume that they all have the same needs or they all have the same wants. Now, for you guys as caregivers, your role in trauma-informed care is to provide emotional support. Now, I always say, and this is something that I have seen personally, when a difficult, and I'm saying difficult, I don't even want to call it difficult, when a patient that has behavior issues,
challenging, maybe.
Yeah, challenging. If you formulate or if you find a balance to where they trust you, I can assure you that behavior is completely de-escalate or is completely absent when you are there. So when you provide emotional support, initially, of course, if a patient is new, you don't know them, they don't know you, there is bound to be issues, right? But if you learn, one, to listen, be able to offer them emotional support, and by doing that, they will feel safe and they'll be trusting of you. And if there is not a bigger role, that is probably the biggest one in my book. Then it is also your responsibility to recognize signs of distress. Caregivers should recognize nonverbal cues and behavior indicating emotional distress or triggers related to past traumas. If you are with a patient and it's raining and there is thunder and there is lightning, maybe what does that do for them? If they have an apartment by a busy road and there is a crash, does that instigate or does that trigger a particular reaction? So if you're able to recognize signs of distress, then you're able to respond appropriately and de-escalate. And we've already talked about creating safe environments. It's also developing individualized support plans. Those don't necessarily have to be written by yourself, but developing an individualized support to where if you are handing over to another caregiver, you're able to tell them, hey, this is what works for this patient. You're able to give them a report on, I wouldn't do this. This is what works. They like to eat at this time. They like to go to the bathroom at this time. They take a shower at this particular time. Then, of course, building trusting relationships and empowering your residents or empowering your clients to promoting self-advocacy and empowerment. Now, practical strategies for caregivers when providing care to our clients is to use calming techniques. Now, we all know that, and I probably did not mention it at the beginning, a lot of patients that have developmental disabilities will get abused by caregivers because some of them need a lot of help. If somebody needs help feeding, if somebody needs help bathing, if somebody needs help going to the restroom, or they are incontinent, they have to, they're wearing briefs. The probability and the dependency to a caregiver is what promotes abuse. Now, in institutions like facilities, right, the one thing that we teach the most on is abuse, because we know that abuse might not just be physical. There are 8 types of abuse. We have mental abuse, to where you can instill such fear in your client that when you're there, they are the best behaved, but it's not that they're the best behaved, right? It is because you have abused them emotionally to where they cannot ask for help. We have isolation, to where a caregiver can go into a patient's or a client's home and lock them because they manifest a particular behavior, right? Lock them in a room and only open the room when it's maybe they're going to check in on them. Isolation is a form of abuse. Verbal, where you're calling them names. We have physical abuse, where you're hurting them physically. We have sexual abuse. We have financial abuse, where we've seen caregivers take clients or patient cards, debit cards, and use them as they will. We also have neglect, where we're not changing them or feeding them enough. Trust me, I have seen caregivers eat patient food and have the patient go hungry. We have seen people exploiting patients or clients. So it is so important, again, when we go to using calming techniques, any one of these abuses does not operate in a vacuum. Most of them, like I said in the beginning, will be a reaction of a caregiver to a behavior that a patient is manifesting. So it is so important, one, if you need to step away, if you need to step out of the situation, go out and take a deep breath. Now, for some of us, these are the things that I have learned further along in my age, that breathing actually works. Taking a deep breath and exhaling. It will lower your blood pressure. It will slow your heart rate down. It will calm you. Because if a patient is lashing out and you hit back, again, one, I don't know, I'm sure you guys are also governed by the same Title 22 that governs us. You will not just lose your life, your livelihood. You will end up in prison. You will end up, again, re-traumatizing a patient that is already dealing with trauma. Then establish a routine and predictability. If you have a patient or a client that you know likes to do things a particular way, establish a routine, not that you are spelling out, but a routine that this patient is kind of spearheading. Then once you have established that, the client will see you come in and they'll be like, oh, Dorothy's here. This is what we're doing. This is, and you're being predictable. So that way, they know what to do. And it also makes your work so much easier because you're not having to force them. You're not having to, today you decide, oh, we're going to start by eating, not brushing our teeth, but you've already established that we're going to brush our teeth, we're going to take a shower, then we will do everything else. Then encourage social interactions, facilitate opportunities for social engagements. So if your patient needs to go to programs, let us make sure that one, they're groomed right, two, that they're dressed right, and encourage them to go out and interact with others. Then adapt to their communication. Again, I don't know if some of you are dealing with patients that are non-verbal, that some that have difficulty being able to express themselves. It is super, super important for you to adapt to exercise adaptive communication. So you should give clear and simple language. Use clear and simple language, use visuals, alternative communication methods to ensure that your clients understand and feel comfortable expressing themselves. And the last one of the practical strategies for you is be patient and compassionate. Healing trauma is a gradual process, and I don't really think there's such a thing as healing, but knowing how to cope and deal with it. So you should be patient and maintain a compassionate approach. And again, that is our first, I want to call it creed. It really should be our first line of thought. One, we are doing this by choice. So compassion for us is not a choice, but if you're in it for the wrong reason, then you cannot afford to find compassion. But if you're doing it for the right reason, patience is a virtue. It's something that you have to exercise. And compassion. Again, I usually like to say empathy goes a long way, because if you look at a patient, or if you have a child that has developmental disabilities, I know of a person in a particular community, and I was very, very surprised because this person is a caregiver, a registered nurse, and they had a developmentally challenged child. And for years, we were friends with this particular person for many years, but we never knew that she had a child that had developmental disabilities, because they actually kept this child locked up in their room. And this particular person did end up going to prison because of the amount of abuse that they actually imposed on this child. Because apparently in their culture, it's an anomaly to have a developmentally challenged individual. So now for this person, if I'm looking at her, it is probably the shame that comes with not having a perfect child. But at the same time, whose fault is it that this child has a disability? It really is nobody's fault, because some disabilities are genetic. So them having that shame traumatizes this child, because I can only imagine what this particular child has gone through. And the way we came to know that they had a child that had disability was by visiting them one day, and somebody forgot to lock the room to this child's room, to the child's bedroom. And this child came running downstairs, went into the kitchen and knocked everything on the counters off. But again, not being empathetic, not giving these people the kind of care that they require is unfortunate, inhumane. But for us as caregivers, patience and compassion should be something that we wear every single day when we step out to take care of our clients. So you play an indispensable role in supporting individuals with developmental disabilities and who have experienced trauma. So by understanding trauma and creating a safe environment, you facilitate healing and resilience. You must prioritize trauma-informed practices and provide and also empower yourself by educating and researching and finding materials that you can read on how to deal with individuals that not only have developmental disabilities, but are also dealing with a lot of traumatic experiences from their past.
Excuse me?
Yes.
I know that I know someone who has experienced trying to explain things to a caregiver, but they argue with them, and the way they make the client feel, then they're afraid to tell them things.
Yeah.
Like they know what's supposed to be done for them, but the other person doesn't think they're right, so they argue with them. And you've got to listen to your client too, so they're not afraid, and don't make them feel bad about what they're saying to you.
Yes. So again, trauma-informed care, its main area of concentration is avoiding re-traumatizing somebody that's already traumatized, right? Because if somebody is trying to say something, and maybe they've been trying to say something all their life, and nobody seems to understand that, and they've developed, or they have gone into themselves and tried not to say anything because they're afraid. Because again, you have to understand that we as caregivers, we always seem to be like hovering over the client. And if you do witness that, then somebody needs to know about it. Because when I mentioned like the 8 types of abuse, mental abuse is one where you instill such fear in somebody, because why will you argue with me when I'm the one that's telling you what I need? So again, communication is a two-way street. You cannot provide the care that I need. You cannot provide me with what I need if you don't hear what it is that I need. Now, in our line of work, we said that the customer is always right. Okay, I mean, not like always right? But when it comes to providing a service, you can only provide a service that a patient wants or a client wants within the parameter that they want it taken care of. So arguing with a client is definitely not the way to go. Adaptive communication, figure out as a caregiver, just be patient enough to want to know, what does this client want? What are they communicating? So wasting a lot of energy engaging them in an argument is counterproductive. And again, let's go back to the issue of patience and compassion.
I used to work in a relay service, and relay isn't just people who are deaf or can't speak. It's also people that do speak and they have speech difficulties. They have hard time saying what they want to say. I raised a son with cerebral palsy, and cerebral palsy doesn't just affect the leg muscles and things like that. But anyway, because of him, I have learned that you have to ask one question at a time.
Absolutely.
You can't always ask either or. You have to ask one thing, let them answer, and then ask the next part, because they only focus on the last part. Same way if you're typing to them.
Yeah.
You can't do that. You have to wait for them to respond, because they do get frustrated. And so because I used that when I was in relay with other STS customers, they would request to speak with me when they had an issue.
Yeah,
So you got to be careful when you're listening to them.
absolutely.
You know,
Thank you.
And it's great to know that you have dealt with, obviously you've been a part of you have a child that has a disability.
Yes.
And again, it goes back to knowing that these children or these clients did not choose to be born the way they were born.
Mm-hmm.
And getting aggravated or getting angry in itself against them for something that they cannot help is not best practice. So again, it is super, super important to listen. Adaptive communication. If you have a patient that's nonverbal, you can use cue cards. You can use sign language, have them show you. what they want if they're not able to articulate it. Sorry, Tim, did I interrupt you?
No, I was just gonna say, like I know we're focused about trauma-informed care for like clients specifically, but you know, and it's because of the kind of life they're having to live, like they kind of when some people are nice to them, they attach themselves to those specific people, and they don't want help from anyone else. So like I really like that, you know, we're all here getting the same information so that the load is not too much on one specific staff member. And you know, they would attach themselves to you, and they would when they have a problem, they want to only go to that one person. But if we all have the same kind of understanding, we don't experience burnout, because now every 2 seconds they're trying to reach you specifically, you know? So like I guess that's just kind of what I wanted to say.
Absolutely. So for me, it's very easy to get attached to patients, but I always tell people, don't get so attached to a patient that you do an injustice to that patient when you're not there. The relationships that we have with our patients have to be healthy, and they still, even when we become very familiar with them, we still have to maintain a level of being professional. And it goes also to if you do nail a particular patient and their behavior and you know what works for them, it is so critical for you to share what works for that patient with the other care providers, so that when you're not there, they know. Because again, it goes back to safe, them being able to feel safe, them being able to know that they are getting understood. So the way you behave to this particular patient that has made them attach themselves to you needs to be communicated to all the other caregivers, because burnout is real. And when burnout steps in, the probability of you being abusive to that particular patient increases it by 90%. So burnout and overextension, because you're the only one that is needed. Because I do know caregivers that want to be needed, and it's okay to want to be needed, but it's so critical to know that at the end of the day, that we are working, it's a professional environment. We cannot be emotionally attached to our patients. And it is important for us to communicate with everybody across the board on what works for this one particular patient. Thanks for that, Tim.
You're welcome.
Anybody else? Okay. So now we can go back and do the post test.
Okay, I'm gonna send that link.
Okay.
And just a FYI, by the way, thank you so much, Dorothy. That was very informative. I personally took a lot of information. I didn't realize there was 8 levels to the kinds of abuse that are out there. I'm definitely gonna go and look into it and do my own research, and I suggest all you guys do that too. So yeah, thank you so much. Another thing, there's 51 people in here, and that's including even Dorothy. I've received a total of, let's see, I've received a total of 33 pre pre-training evaluations. So meaning I'm gonna go through it, and if your name's not on there, I'm so sorry, you're not gonna get credit. I warned you guys before, so I'm gonna send the post one right now, and you do it. So we can do it together with Dorothy. You know, the post one. But yeah, you want me to share my screen, or are you gonna share your screen, Dorothy?
Oh, you can share yours,
Okay.
or I can share mine. Mine is
Okay,
still
yeah, sure.
shared, actually. No?
Yeah, so okay, I'll
hold on.
share my screen.
All right.
Let's see.
Did you receive mine? Lisette?
Let me
Can you
see
check?
the set. I'm gonna just share my entire screen. So these are the people who sent it. I don't know if I could. Lisette, if you hit submit, then you should be here, but you know, I've received 33. Okay. But
Oh,
Lisette,
yes,
if
it's
you,
mine.
you know,
Yes,
I saw you were
yes,
here.
it's there.
Yeah, I saw
I
you were
see.
here because I logged the Zoom call. Oh yeah, right there, I see it. But anyway, so
Okay.
this is the post training, so we'll do it together. Dorothy, I'm gonna need your mic on because we're gonna give the answers away.
Huh?
I said I'm gonna need your
Okay.
mic on. Let's see. Let me stop recording real quick. You
So are there people that need time to complete it? Or we're gonna go with the 33 that have submitted?
Yeah, so you know, like we're gonna everyone who's here is gonna we're gonna do it together, this last one. So it's gonna be real quick. Okay. All right. Wow. Sorry. Wow. Okay. Number one, true or false? Trauma causes changes in the brain and body that can happen without us. True or false?
No, yeah,
Huh?
it's supposed to be without us knowing.
Oh, sorry. Without us knowing. Oh, so this is true.
Yeah.
True or false? Only a small number of people have had traumatic experience. False. Trauma may affect a person's health and well-being long after the traumatic event, right? I missed that one too, event. This is true. Triggers are things that remind someone of dangerous and scary situations that, oh my God.
Or scary situations, yeah.
Yeah, so this is true, yeah?
Yes, it is very true.
When caring for people who are distressed or resisting care, it's best to talk loudly and focus on getting your task done. No. Tell the client that everything is fine and there's nothing to worry about. What do you think? Provide choices. I'm leaning towards C, but you know. Dorothy,
C.
it's
Yeah,
C, yeah?
why do I think there's something missing from that question? Give me just a minute.
Just go.
Tim, give me just a minute.
Okay, well, 5 is on pause. We're gonna go to 6. Trauma can be caused by natural disasters like fires, tornadoes, floods. B, car, bus, train, or airplane crashes. C, observing violence. D, a personal experience with loss or grief. Or E, all the above.
All the above.
All the above.
Is the correct
Yeah,
answer.
you guys can chip in too, yeah. If someone lived through a traumatic experience, which of the following may be true? Can we count this thing?
Oh. That's how
Yeah, we'll continue later. Sorry. This is a multi-use office. I need to get my own. Anyway. What do you think about 7?
A and B.
Both A and B?
Yeah,
Yes.
number D.
Okay. All right. Learning about the signs and symptoms of trauma is important because
All of the above.
Number B.
D.
I'm hearing D. Okay, D.
D.
The answer is D. To ensure our
D.
clients feel
Number
safe.
D.
Yeah,
You said B?
No, D.
D for dog.
D. Yeah, D for David.
Okay, cool. I'm just trying to check if you guys are paying attention. To whom should you report changes in the way a resident is acting?
Supervisor.
B, a supervisor?
Supervisor. B.
Okay, B. The goal of providing trauma-informed care is to
Recognize, respond, and avoid re-traumatization.
Very good.
B.
boom. And that's it. Thank you for filling out the form.
Yes, and thank you again so much, Ms. Dorothy, for joining us. We are always so so grateful to have you. And
Thank
everyone,
you.
please
Thank you so
join
much.
us. Yes, please join us again at 4 p.m. for another training. It is also paid for another subject. She's going to train us.
Hey, come on, look, baby.